Jessica is now in Phase II of her rehabilitation for her ACL reconstruction. Phase II includes weeks 6 through 10. At this point, Jessica should have full extension of the involved knee and capable of performing a straight leg raise without any extension lag. She should have at least 90 degrees of flexion, preferably close to 120 degrees by week 7 and 8. There should be minimal swelling, and she should have a normal gait pattern by week 6 on uneven surfaces. Because rehabilitation is progressing as it should, Jessica returns her crutches by week 6. The brace should still be worn during the day to prevent any unwanted movements and to protect the graft. The athlete may have some soreness due to rehabilitation exercises and may experience pain with pressure changes in the air, which is normal for this invasive surgery. The scar appears to be normal, no oozing or pus near the incision site. 2 to 3 times a week, Jessica receives massage over her scarring to prevent buildup of scar tissue, which can cause problems in the future if not handled appropriately. Jessica is encouraged to use the bike when she has downtime and as a warm-up to increase range of motion, as well as work on increasing the strength in her leg. The goals of this rehabilitation phase include restoring normal gait with stair climbing, maintaining full extension progress and increasing flexion range of motion, protecting the graft and graft fixation, increasing hip, quadricep, hamstring, and calf strength, and increasing proprioception. The following exercises will be introduced during this phase of rehabilitation as the athlete is able to perform them. The athlete is encouraged to bike to maintain cardiovascular fitness. She's also encouraged to continue her upper body workout regimens as closely as possible to maintain her upper body's strength for return to play. The athlete will perform hamstring stretches daily and assisted by the clinician. She will also be instructed to stretch her gastroc and her soleus daily. To perfect the athlete's gait with stairs, have her do simple step-ups with a small step and then increase to a larger step, possibly with an uneven surface. To increase the difficulty, a squat or lunge can be added in after each step up. During this phase, lunges can be introduced to the athlete. As she performs lunges, she is asked to do it along a straight line to relate it back to her sport, gymnastics. To increase the difficulty, the patient may be asked to hold a medicine ball while doing the lunge, or to perform an overhead press with the medicine ball to work on her balance, proprioception, and coordination. The weight of the medicine ball may be increased throughout rehabilitation. Squats may also be introduced at this phase of the rehabilitation process. The athlete should begin with regular squats that aren't very deep and then progress further. Next, you can add a medicine ball overhead press. Depending on how far she is in her rehabilitation, increase the weight. Next, you can progress to one-legged squats that don't go very deep but challenge the athlete. Following this, you can progress to an uneven surface, a dynadisc, a trampoline floor, or anything else to increase the balance, proprioception, and coordination of the athlete. During this phase, the clinician wants to watch for medial collapse and correct this as soon as possible. As always, maintaining the core strength of the patient is important during this rehabilitation. Planks, push-ups, and Swiss ball push-ups can be utilized during her rehab, as well as Russian twists with a med ball, side crunches, and any other core strengthening activity that the athlete or the clinician may come up with.